you go. Okay, take it away, Major.
All right. Hyperbaric oxygen therapy. Some frequently asked questions for patients. What is hyperbaric oxygen therapy? Well, you're going to sit in a chamber. We're going to fill the chamber with 100% oxygen. It's liquid oxygen in a tank that's outside of our facility. We're going to pump the chamber full of oxygen, and so your body's going to absorb more oxygen while you're at depth. So depending on what your provider is going to put you at for your depth, we go anywhere from 1.5 ATA to 2.4 ATA, so anywhere between 28 feet to 48 feet. So that all depends on what your goal is medically wise, what you're trying to aim for. Whenever you're in the chamber, it's just like going scuba diving or in an airplane. You're going to have pressurized, air, so your ears are going to pop. That's the main thing in hyperbarics that we're looking for people first time. Just making sure that you're able to equalize ears and get down easy. So before any treatment or you start treatment, we check your ears, make sure your tympanic membranes, looking good and clear, and there's no swelling, allergies, or anything like that. HBOT is a medical treatment, not just extra oxygen. So during HBOT, a person breathes high concentration oxygen when inside a pressurized chamber. The increased pressure allows more oxygen to dissolve into the blood plasma and reach tissues that may be oxygen starved. So basically, with inflammation or any ailments, things like that, your body's just not getting enough oxygen to help the healing process. So with the oxygen, we're pushing more of that oxygen into your cells and tissue, which is going to help your body recover quicker for any inflammation, surgeries, wounds, things of those natures. And how can HBOT support healing? So basically, it's going to deliver oxygen to your body. It's going to push all that oxygen as deep into your cells and tissues as you possibly can get, which is going to be the main factor of healing for the HBOT. With that extra oxygen in your system, you're going to have new blood vessel growth, you're going to have immune support and swelling control. So all that oxygen is doing is allowing those cells and tissues to recover and push out all the bad fluids. Sorry, I almost fell. Uh, but it's generally just an adjunct. It works alongside with the diagnosis, wound care, surgery, medications, rehabilitation, or regenerative therapies with clinical appropriate. So basically, you're going to get everything that you're going to need out of it based off of what your provider puts you at for depth. What can HBOT be used for? Emergency and life saving. Carbon monoxide is a big one. To flush out the carbon monoxide, a big portion is you put you in this chamber, flush you out with pure oxygen to get the the carbon monoxide out of your tissues. Wound and tissue support, selected non-healing wounds such as diabetic foot ulcers, compromised grafts and flaps, radiation tissue injuries. So anything that's needs to be healed for cuts and things like that, it helps mend quicker. Serious infections and injuries, necrotizing soft tissue infections, chronic refractory osteomyelitis, crush injuries, and acute traumatic ischemia. Other selected uses, sudden sensorial hearing loss and central retinal artery occlusion are included in hyperbaric medicine references. So basically with eyes, the main thing we look for whenever we have a new patient is making sure that cataracts, because hyperbarics can speed up your cataracts due to the pressure increase in the chamber. So we do like to make sure we check that beforehand. For infections and injuries, same thing. We just want to make sure that everything's on par.
So is it okay if I jump in?
Yeah, for
What
sure.
what are some of the typical, other than, when you see our clients coming in for regenerative medicine after their regenerative medicine treatments, what are typically some of the clients that you see coming into your chambers, and what are they using the chambers for?
So a lot of our clients, we do wound care, so open wounds, things that aren't healing as quickly as they should be. We get a lot of post-surgical facelifts, breast augmentations, things of those natures. Uh, Mold and post-COVID, long COVID, people that have had COVID for a long time and haven't seemed to recover with their lungs or breathing. The oxygen hyperbaric helps with that. We get cognitive brain issues, TBIs, things of those natures. The oxygen really helps stimulate the neural growth in the brain, so it helps out with the TBI patients. But most of the things we see here are the wound cares from you guys with your PRP injections, stem cells, things of those natures. But that's pretty much it that we see here.
Yeah.
All right, who might be a candidate? So first, you're going to check your medical reason, see what the reason for your interest in hyperbarics. There's so many different things that you could use it for. So we'd like to figure out what your reason is and then get you on the right path to figure out what your ATA depth you need to be at and how many sessions you should, go through and things of that nature. And then we do a safety screening. So every patient we have come in, we have a practitioner, or either the physician or nurse practitioner, go through an entire safety evaluation. We make sure that don't have any, seizures, low blood pressure, high blood pressure, that you anything that could be a compromise to treatment. So, COPD, you know, anything with lung related. If you've had any cancer, any radiation, things of that nature, we'll find out. Uh, if you've had your hair done, your nails done, anything that could have any chemicals on your body within 24 hours that could be dangerous in the machine. So any of those things, when we have a patient, we're constantly checking. No cell phones, no electronics, nothing in the chambers at all, obviously, because they are electronic and they can cause a spark. And with oxygen, that's a no-go. And then the care plan. So the care plan basically comes down to what you're trying to accomplish for your treatments. So like with you guys with your regenerative health and PRP, it's better to get into the chambers before your injections so you have a better overall healing aspect after your injections. So you do HBOT before your injections, get your injections and do injections afterwards. You're going to have a faster healing process. I mean, the people we've seen come from you guys that are doing the hyperbaric before and after compared to the people that aren't is tremendous difference.
Cool.
Who may not be a candidate? So absolute contradictions. Like I was saying, it was untreated pneumothorax, collapsed lungs. Basically, you don't have enough pressure in your lungs to sustain in the chamber, so that is a no-go for that. Common reasons to delay or require extra clearance. An active upper respiratory infection, fever, significant sinus, ear problems, or other ear surgery or ear injury. So that goes back to just the pressure changes in the chamber for the ears, the tympanic membrane. If you have any infections, fevers, or anything like that, it could cause your ears to get filled with fluid and make it difficult to equalize. Certain lung diseases or air trapping conditions such as COPD, asthma, blebs, or that just goes back to the lungs. Any type of air you have trapped in your lungs, COPD, under pressure, those bubbles are going to be pressure or squeezed, and it's not good for anything while you're in a chamber. So those are need a little bit of extra required clearance. Medications. We have a list of medications that we want to make sure that if you're on, that you're when you're taking it, how much you're taking, things of that nature to make sure that the pressure isn't going to affect any of your medication that you're taking. Pregnancies, implanted devices, uncontrolled seizure risk, or difficulty tolerating confined spaces. So, pregnant women, obviously, you have a child in your stomach, pressurized. It's not good for that. Implanted devices, pacemakers, and things of that nature. Some are okay to go into chambers. If you do have a implanted device, we just have to get the model, the serial number, and contact the manufacturer to see if it is cleared to go into a chamber. And then confined spaces, that just goes to claustrophobia. If somebody has some claustrophobia, we have ways around that. Our chambers are fully open with acrylic windows with TVs. And so we put TV shows on, cable TV. We have radios, talk to our patients. So we have ways of getting around confined spaces. What should you expect during a session? So basically, the way it works here at Bennessair is when you come into a session, you'll check in with the front desk. They'll bring you back. We'll get you on a gurney. If it's your first session, we're going to get vitals. So we'll get blood pressure, temperature, your oxygen percentage, and check your ears to make sure you have your tympanic membranes fine and there's no inflammation. We'll get you on the gurney. We'll give you a safety rundown on how we operate the machines, what you need to expect, what you can and can't do, what you can and can't bring inside the chamber. We put you in the chambers, put on your TV show, and we set you in. So most of our treatments are 60 to 90 minutes. It takes anywhere between 10 to 12 minutes to get to your depth. And so once you're at your depth, all you're doing is staying there, watching your TV show and relaxing and enjoying your time. After your treatment, you're gonna, or during it, you're just gonna sit there and enjoy your show. If you have any questions or things like that, all you have to do is let your tech know, and we can communicate with you through the machine. After, we're gonna decrease the pressure. You're gonna come back to atmospheric pressure. We're gonna check your vital signs, make sure that nothing increased. Normally, after hyperbaric, your blood pressure can increase. So with people with high blood pressure, we do like to check afterwards just to make sure there's nothing we need to worry about. We get you out of the machine. Most people, the first thing they want to do is get a drink of water because they've just been stuck in a machine for an hour and a half. But what are the possible side effects or risks? It's generally well tolerated. It's medically supervised with techs and physicians, so there are risks and side effects, but most of it is pretty minuscule. Common usually is like we were talking about was the ear pain, the ear pressure, fatigue or sleepiness after a session. That's common. Just getting completely saturated with oxygen. A lot of people kind of get relaxed and tired. And then mild anxiety or claustrophobia. You are being put into a chamber. Some chambers are very small with small windows, and that's what a lot of people think of when they think of hyperbarics, and so that's where their mind goes to. But like I was saying, ours have a little bit of extra leniency to making you feel less claustrophobic. Less common but important. Middle ear injury or eardrum rupture, temporary vision changes after repeated treatments, oxygen toxicity, breathing symptoms, or seizures are rare but serious. So yeah, middle ear injuries. I've never personally have seen one. We try to keep on top of people's ear problems in the chambers by letting us know as soon as ears aren't clearing. But things can happen if you do not notify your technician. Uh, for the oxygen toxicity, we are very strict on our time limits and how long we can do treatments. Some treatment facilities will do air breaks. Our facility, we do not do air breaks. Our physician doesn't see the benefits in air breaks, and I'm with her on that as well. But with the toxicity, if sometimes we do have patients that will do two treatments in a day. If we do treat two treatments in a day, we ask that we give a 4 hour gap in between treatments from in to start of the next one. That way, we're minimizing the risk of oxygen toxicity. For safety rules that matter, high oxygen environments increase fire risk. Follow clothing, skincare, item restrictions exactly. Use trained, accredited, medically supervised settings. So yeah, the chambers are fully oxygenated. Oxygen is a highly combustible gas. We do have very strict policies for our chambers. We only allow cotton clothing in our chambers. We have scrubs for people to change into because cotton clothing is hard to come by these days. When it goes back to skincare, like I was talking about with hair extensions, nails being done, anything that has to do with like a chemical that can be explosive, we ask that there's a 24-hour break in between those. That way there's no risk to us or you. For trained, accredited, medically supervised settings. So like Dr. Goyle was talking on earlier, our facility has techs fully next to the machines the entire time. We have nurse practitioners on staff and we have a physician on staff. So we have all the people ready to be there when needed. Um, if you do have any issues in the chambers, we have methods of getting our attention and being able to talk to you. So the biggest thing is if you're feeling something that's uncomfortable or you're having a question about or you're concerned about, the best thing is to let your tech know sooner than later. How does HBOT connect with regenerative medicine? Think environment optimization, not replacement for regenerative procedures. So you're going to have oxygen, blood flow, tissue signaling, and recovery plan. So regenerative medicine asks, can we improve the local environment to the body so the body can repair and remodel tissue more effectively? HBOT may support that goal by improving oxygen availability and hypoxic tissue, supporting new vessel in connective tissue formation, helping immune cells function in compromised tissue. So basically, what HBOT is trying to do and set up to do is to improve the oxygen availability in hypoxic tissue. So hypoxic tissue is tissue that is low on oxygen or lack of oxygen. So the oxygen that we are pushing into your cells is tissues is going to create new blood vessels, connection tissue formation to help you heal and get those immune systems functioning better. Important boundaries, it does not replace diagnose or biomechanics, rehabilitation, injections, procedures, nutrition, or follow-up care. It is one possible adjunct. HBOT is not a end-all be-all. It is something to help in adjunction with what you're doing. So with your regenerative medicine, HBOT is going to be there to make that take quicker and heal faster. So your patients will have a quicker recovery time and they'll see a quicker uh, you know benefit to the procedure. Why we repair them and why it matters for your result. Regenerative treatments, PRP, bone marrow, regenokine, introduce your body's own healing signals. HBOT creates the optimal environment for those signals to work together. They don't add up, they multiply. So like we were talking about pre-treatment, we're going to flood the target tissue with oxygen before the procedure. It's going to give you the best recovery, reduce the existing inflammation so your immune system is ready to heal, prime stem cell mobilization from bone marrow, optimize tissue receptivity to growth factors. So HBOT has been shown to increase stem cell growth from bone marrow. So using that with your regenerative health is going to be a great added benefit. Post-treatment, we're going to accelerate healing cascades initiated by PRP, BMAG, or regenokine. Keeps regenerative signals active longer in the tissue, prevents post-procedure inflammation from sabotaging results, speeds recovery so you feel results weeks sooner. Like I was touching earlier, the patients we get from Dr. Goyle, that are doing HBOT and the PRP and BMAC and regenokine, compared to people not doing HBOT we're seeing a massive difference. So usually about your patients by day 3 is about the height of their pain. After day 3, they're on the up. By day 4, day 5, they're fully mobilized, feeling a lot better than what they were. Usually by about a week after we see them from treatment, they're already seeing a lot of benefits from the injection. So everybody's been just loving it and talking highly of it. So it's great to see that every day.
That's great.
Things to know after your treatment. A good response plan is specific, measured, and monitored. Right after you may feel tired or relaxed, many people resume normal activities. Report ear pain, shortness of breath, chest discomfort, confusion, or vision changes. If diabetic, follow glucose monitoring instructions. So, yeah, basically, like we touched on, if you feel anything after let your tech know. Don't try to keep anything just so you can keep doing because you think that's going to be helping you. If you try to keep things from your techs, you could be causing more damage down the line. So, if you're feeling anything, please let us know as soon as right after. For diabetics, we like to check your glucose before and after. Hyperbaric will lower your blood glucose level, so we just like to make sure you're safe when you're leaving. Course of care. Benefits may require multiple sessions depending on the induction. Keep the full treatment schedule unless your clinician advises otherwise. Progress should be tracked against a clear clinical goal. So yeah, basically just keep track of everything. Don't try to miss anything. I know sometimes things come up. If you have to miss one, let us know and try to get in as soon as possible. The more you can repetitively get into HBOT after treatment, you're going to see those results quicker. It's going to keep your oxygen, your cells saturated longer. You'll have more time, better healing. If you take breaks off your that oxygen leaves your system, you're not going to have that same saturation to help healing. Hydrate and follow nutritional guide. Avoid smoking and nicotine when advised because oxygen delivery and blood flow matter. Continue rehab, wound care, medication, and procedure follow-up. So, yeah, touching on nicotine, smoking, and things like that. Nicotine, um, it basically counteracts all of the oxygen therapy. Your body is now full of nicotine, and you're not going to be absorbing as much oxygen as you can. So, if you do smoke, try not to smoke before treatments, and try to wait 2 to 3 hours after treatment to smoke a cigarette. Because if you smoke as soon as you finish a treatment, it was basically just you null and voided that entire treatment. And then for continuing rehab and wound care, medication and procedure, just make sure you follow up. Don't, if you see something, don't try to avoid it. Make sure you let your doctor, your physician know.
So,
Facts.
yeah. Do we want to maybe we can go to like some questions and answers?
Yeah, whatever you guys need to do.
Let's see here. I'm gonna exit this. So let me just stop the share because I can ask some of these and have you answer it. So because I feel like you kind of you answered a lot of these so far. So one of the questions is, does it hurt?
It does not hurt. The only thing that could possibly hurt during the treatment is what we touched on with ears. Yeah, that's the only thing that people are going to have pain with normally. So big thing is if you're prone to allergies, we try to take take Afrin beforehand, 30 minutes, an hour before your treatment. Take it the night before to just kind of help clear up those allergies. If you aren't prone to allergies, and you do have ear issues, like say flying an airplane, you get ear pain, you have problems equalizing going up mountains. Those are things to let your physician and your techs know beforehand so we can go slower, manage your depth and how fast you go down. That will decrease the pain in the ears.
Nice. And then another question is how many sessions? So I'm sure it depends on what you're coming in for, but typically when do people start noticing a benefit after they do hyperbaric oxygen?
So usually about 3 to 4, you'll start seeing benefits. So the first benefits you're going to start seeing are going to be better sleep, feeling better rested and things like that after a night. You'll feel better energy, more energy throughout your day. So during the day, you'll just kind of feel like, oh, I'm not as tired as I normally am. So usually about 3 or 4 treatments, and you'll start kind of feeling those initially. And then the more you do, you'll start feeling. Now everybody's a little different. Some people, have an incredible difference with hyperbarics, and some people feel small amount. So it really just depends on the person, I think, for that type of outcome.
Okay. And then what is the difference between, I know Dr. Goyle talks a lot about the canvas hyperbaric, like he calls it the fake hyperbaric. What's the
The
difference?
soft shells.
Yeah,
Yeah, soft
Yeah.
exactly.
shells. Yep.
Yeah.
Yeah, so what's the difference between what you guys have and what, like if you were to go to like Restore or another facility that has those canvas units, are they the same thing? Are you getting the same benefits as you would in a medical grade?
You're getting benefits, but you're not getting the same benefits. So with soft shells, you can only go to a certain depth. Most of them max out at 2.0 atmospheres. Some of them max out at 1.5. You're also not breathing 100% oxygen air the entire time. Like you are through a nasal cannula or a non-rebreather mask, but you're only getting about 70% of that 100% oxygen because you still have excess air coming through the cannula and the mask. With going to deeper pressure, we can get more infusion and pushed into the cells and tissues. So the more oxygen we can get infused into your tissues and cells, the better your outcome is going to be. So with 1.5 ATA, 2 ATA, you're not going to be able to get that depth that we're trying to achieve. So most of our patients that come from post, we're at a 2.4 atmosphere, which is 48 feet depth. So with the soft shells, you're not getting that. You're also it's you're getting benefit. It's just you're not getting the full benefit that you could possibly get.
Okay. Let's see, what else do we have? How long is a typical session?
So typical is about 60 minutes, an hour. We do 90 minutes and we do 2 hours. We only have a few people that do 2 hours. 90 minutes seems to be the best bang for your buck if you're trying to get the full amount of time, because for 60 minutes you have travel time and you have decompression time. So during that travel time, that decompression time, that's 10 minutes of travel, 10 minutes of decompression. So that's 10, 20 minutes total. You're not fully at your depth breathing your oxygen. So if you do the 90 minutes, you're getting that full hour plus 10 minutes of oxygen treatment.
Nice. Um, what about pain? So we have a lot of, so obviously we've got people who are using this with their regenerative procedures, and to help speed up the healing. But what about pain and inflammation? Does hyperbaric oxygen help with that?
Tremendously, yeah. So a lot of our patients will have come in that have, pain or inflammation and things like that. As soon as they're out of the chamber, they're feeling a lot better. It's that oxygen getting into the inflammation, letting it kind of settle, lets the joints kind of get a little bit of a break. It adds a little bit of space in between there. So a lot of the times when people finish a treatment, they're a little poppy, like their joints have a little more space because they're now saturated. So you will see a lot of, not a lot, but you will see benefits after your treatment for inflammation pain.
And so, but somebody could use this just specifically for pain. So let's just say they're not doing a regenerative
Yeah,
medicine
just for
treatment.
pain.
They could just come in and do this.
Tremendous. Yeah, 100%. Anybody, if if it's ligament pain, inflammation pain, broken bone, things of those natures, it's going to help. And there are caveats to that. Like if you have a broken bone or torn tendon, you have nerve damage from that injury. HBOT is going to help regrow those nerves. So what you might not have felt originally after HBOT, you're going to start getting those nerves to regrow. You're going to start feeling a little more pain. So if you're coming in for like a broken bone or things like tendon of those, you might feel more pain not after your first treatment, but once that HBOT starts working and those nerves start to regrow, you're going to start feeling a little bit more sharp pain in that area. It's a good sign. It's not a great feeling, but it's a good sign that your body's on the way to healing.
Nice. Cool. Any other questions or anything else that you want to talk about, Ash?
I mean, there's so much to talk about with
So
hyperbaric
much.
oxygen therapy. There really is. I mean, it's an incredible field of medicine. It's been around for over a century, since the 1800s, originally for the bends and helping people working underwater who would get decompression sickness. It could save lives. We know we've extrapolated it to many other conditions that can actually save limbs, and it can save lives too. Like we talked about, deep infections in the body, in the bone. Um, these non-healing wounds that can get so infected that the only option, if they don't respond to antibiotics, is amputation. So hyperbaric is a powerful tool. So it has the ability to stimulate our immune system, profoundly reduce inflammation. In my regenerative protocol, I use it because number one, it reduces inflammation, which is what we want. Number two, it also forces oxygen into the tissues. So I use the analogy of preparing the soil, right? Preparing the soil and making the seeds. When we do these regenerative therapies, the patient or the client is making the stuff we're going to be injecting back into the body, and their body is going to be receiving the stuff we're going to be injecting into their back into them. So we need to optimize the soil and we need to optimize the seeds. So I want really, really good seeds and really, really good soil. So when I plant the seeds, they're going to grow and flourish and thrive. Hyperbaric is a powerful way that we can stimulate release of growth factors in our body. We can mobilize stem cells from our bone marrow into circulation. We can reduce that inflammatory load that most of us experience on a daily basis and not even know it. All of these things matter. When I'm treating a knee, so we talked about getting oxygen to places where there's very low oxygen tension. For example, inside our discs in our back, inside the knees, where we have cartilage, there's very, very minimal blood supply to those tissues. So the rationale for doing hyperbaric before we do a biologic is to hyperoxygenate those tissues, get blood flow into those areas so we can get rid of some of what we call the senescent cells. These are zombie cells that float around in our body, and they basically send molecules out and signals out that create inflammation. Hyperbaric oxygen therapy is very profound at basically relieving senescent cells and decreasing that inflammatory burden in our body, but also stimulating oxygen to enter the tissues that normally don't have a good supply of oxygen or a good way to get oxygen. So all of this really primes the areas in the tissues that we're treating. Post-procedure, with a lot of these therapies, there's a big flare up that can happen, and it can be very, very uncomfortable. Hyperbaric oxygen therapy, we know from decades of studies and data that it can promote wound healing. So I tell people when we do these biologic therapies, we're creating these micro wounds inside the tissue, like inside the ligaments, inside the tendons, inside the joint, inside the spine, because we want a healing cascade to happen. Hyperbaric oxygen therapy can augment that whole process. And as Major was saying, he sees my clients. I mean, you see them more than I do post procedure. You see them every day. And, usually around the first 1 to 3 days is the worst for the post procedural flare. But then after that, it drops off significantly for those who are doing the hyperbaric oxygen therapy. Um, so I incorporate that into the post procedure protocol as well, not only to speed the healing but also to reduce the post-procedural flare and discomfort, which for some people can be pretty profound. And we see a big difference too. In the people who don't do hyperbaric oxygen therapy, their recovery is definitely longer. It just takes longer. Unfortunately, not everyone is a candidate for hyperbaric. Not everyone can tolerate hyperbaric. As we talked about, the ear pressure. I've had my own challenges when I've been under the weather, when I've had a sinus infection. Major, just a few months ago, I was in the chamber. We couldn't go above below 1.25 atmospheres. I was tapping out. I mean,
Tap it
that
out.
pressure was so intense. And I was like, listen, I just want the oxygen. So just to breathe 100% oxygen in the chamber, even at 1.25 was better than nothing for me because I felt so miserable. I hadn't been sick for 2 years. But that pressure, oh my gosh, that can get really intense. And so I mean, having experienced that, I feel for people who go in there and they're like, listen, I could only get to 1.3 and it was so severe I had to stop, I had to tap out. Because I actually saw someone recently who I think I did his procedure last week, but he couldn't get to beyond 1.3. I think
Yeah.
1.3 he just couldn't tolerate it and then had to quit. So I don't know if he ever came back, if he's had that opportunity yet, but yeah, some people just can't do it, and that's okay. We work around it. But for those of us who can, it's a tremendous tool. There have been a lot of studies coming out from Dr. Shaya Fradi. He's a internist in Tel Aviv, Israel. He's published tons of publications on hyperbaric oxygen therapy. He's been treating traumatic brain injury. He's treating stroke victims. And his whole philosophy with traumatic brain injury or with stroke is that we treat it like a wound. Hyperbaric oxygen therapy is a wound therapy. So if you injure your brain, either with a traumatic brain injury or a stroke, the tissue responds the same way any other wound in our body would. You treat it with hyperbaric oxygen therapy, that wound can heal. And he's demonstrated in people, even years after a stroke, they can regain neurological function with his hyperbaric oxygen therapy protocol. It's remarkable. Traumatic brain injury, same thing. Traumatic brain injuries, concussions, it can take weeks, if not months, to recover from those. And some people don't ever recover. But hyperbaric oxygen therapy, for the physicians who are forward thinking, who deal with patients who have these types of injuries, to get them into hyperbaric oxygen therapy, you can get pretty profound recovery, and it can happen a lot sooner rather than later. He's also done a study. Shia Fradi has also done a study on uh, a longevity protocol that actually increases the telomere length. So telomeres are little filaments at the end of your chromosomes on your DNA, and the length of the telomeres is associated with longevity. So the shorter they are, the closer you are to dying. The longer they are, the further away you are from dying. And he's got a hyperbaric oxygen therapy protocol that is reproducible. That shows that hyperbaric oxygen therapy at the right dose, at the right in the right protocol, can increase those telomere lengths. So it's anti-aging as well. I mean, that's one of the reasons why I do the hyperbaric oxygen therapy. I just feel good. It gives me energy. It helps me sleep better. Like you said, sometimes you feel wiped out afterwards, and so I never know how I'm going to feel. Like Nikki and I talk about that, like on a Friday, if I go in a Friday afternoon, she's like, "What do you want to do tonight?" I'm like, "Oh, I'm up for whatever." She's like, "Well, let's just wait till let's wait till you come out of hyperbaric before we make any plans." Because You're either going to be wiped out or you're going to be just fine. So, and that's really the case. It really depends on what my body needs at the time and how it responds to the hyperbaric oxygen therapy. Now, I do have people who've done 20 sessions and they're like, I don't feel any different. Sometimes you don't feel the physiologic change that's happening in your body, but it is definitely happening in your body. And it's happening on a cellular and molecular level. You may not have that full physiological change that's recognizable. It's like, oh, this is doing something. It's doing something. I mean, that's how this works. I mean, it's the studies have shown that hyperbaric oxygen therapy, at different atmospheres of pressure cause different physiological responses in our body. Whether you feel it or not, your body is responding. So, again, for me, it's about the pre-procedure protocol and the post-procedure protocol and optimizing outcomes with these biologics. So much of what we do with regenerative medicine and orthobiologics is participatory. You know, our traditional medical model is passive. You show up with symptoms, we're going to do something to the symptoms. And the doctor does it, not the patient or the client. It's the doctor that does something. Like I'll do a cortisone shot or I'll do this procedure, whatever procedure it is. With regenerative medicine, people are an active participant in their care because we're using your biology to make a product to treat whatever injury or ailment you have. And so participation is key. And so I give people all kinds of tools to make the process as successful as possible. And hyperbaric is one of the most profound that I've found. I mean, all the things I do in my practice, I've experienced myself. I did hyperbaric for myself before I ever referred a person for hyperbaric. And my first ever experience and my only experience with hyperbaric oxygen therapy has been at Bennessair, and I've been going there for about 3.5 years now. And for me, I went after a PRP procedure in my knee, and normally PRP for me is always taken traditionally 3 to 6 months to have any effect whatsoever. For the first 6 to 8 weeks, I'm like, this is horrible, and I'll limp and it's painful. That's just my reaction to biologic therapies. But this last time I had PRP in my knee was March of 2023. Literally, I did a hyperbaric protocol 2 weeks to the day of the procedure. I'll never forget. I was walking in LA for we couldn't find an Uber, so we ended up walking like 2 miles, and I had the epiphany. I was like, oh my gosh, I have no knee pain. Like it's gone, and it had been gone 2 weeks to the day, and it went away for over 3 years before it started coming back again. But the hyperbaric oxygen therapy was the only thing I did differently with the last round versus the previous 2 rounds. And so I attributed to that, and then I started experimenting clinically with my protocols, and I've kind of got it dialed in now. But there's so much I can talk about hyperbaric, but hopefully people will watch the webinar, they'll get intrigued, they'll get some insight, they'll understand the difference between like true medical grade hyperbaric oxygen therapy versus the med spa or the IV clinic hyperbaric oxygen therapy. I tell people, look, even at 1.5 atmospheres of pressure, you'll get some benefit. Is it worth the money you're spending on that? It is if you have the time to go maybe, every single day for 3 to 6 months, but it's not going to be the same as what you would get at a higher atmosphere of pressure with 100% oxygen. That's the main difference. Most of these other facilities, you're using a face mask or just a nasal cannula, and the pressure you're getting is air pressure. So you're forcing 21% oxygen into your body, which is the fraction of inspired O2 around us. So, when you breathe in the air, there's 21% oxygen roughly. That's what's getting forced into your body. When you're in 100% medical grade oxygen chamber, it's 100% pure oxygen that's getting forced into every cell in your body. So a big difference there is almost 80% difference in what you're actually getting forced into your body versus a non-medical grade chamber. So always be aware of that. Again, I think hyperbaric oxygen therapy, even at 1.5 and with a nasal cannula, is better than no hyperbaric oxygen therapy at all, especially for these types of conditions we talked about. But for more serious conditions, definitely do hospital grade.
I have a question about people who you mentioned claustrophobia. So, what happens? Because we do get a lot of clients that I shouldn't say a lot, but we do have a number of clients that will say, "Oh, I haven't tried hyperbaric because I'm claustrophobic." What do you do to help those people? I mean, I know that it's all glass, so it's all open, but you're still kind of in a chamber. There's a door that's behind you. What's your protocol?
So if we have somebody who's highly just terrified and kind of nervous of getting in, we'll take it step by step. So we'll get them on the gurney. We'll kind of show them the chamber, how everything works, go into it in detail just to make them feel a little more comfortable. We'll push them into the chamber. We don't close the door yet. We just let them lay in the chamber and kind of feel what it feels like without the door being closed behind them. So that way they know that, okay, I'm not locked in here yet. They kind of get a little bit comfortable with it. Let them see that the radios work. We talk to them on our radio. They talk to us, can see that all that's working and that there's no issue there. We put a TV show on while the door's open just to let them kind of get comfortable. And then once that person kind of feels like, okay, I'm ready to try this, we close the door and we stay by the chamber the entire time until they're at depth and they feel comfortable because we don't want to leave somebody sitting there in their own thoughts. You're like, oh my goodness, what am I doing? So we
Right.
try to stay by the machine for the entire time and coach you through it and make sure everything's fine and things of that nature. And so we have blankets, we give water bottles and things like that. You can take in there and drink your water, put your show on. So we try to do everything the best we can to make you feel like you're not sitting inside of a chamber for an hour and a half.
Okay, cool. Russ, do you have any questions?
No, I probably, am I unmuted? Yeah, no, I've been there a number of times, so probably a major nose. Good
I know,
job.
Russ.
But no, I do think it's once you're adapted to it, it's actually soothes your brain. I think, it's a matter of focusing on just relaxing, and the oxygen therapy afterwards. I can tell you, I definitely feel better when I get out of it. So
Nice.
makes a big difference.
Yeah. Hey Russ, do you guys ever use hyperbaric oxygen therapy for the horses in the
Yes.
equine? Yeah.
Yeah, they've been used at several facilities, actually at the World Equestrian Games in Atlanta, Georgia. They had them there as portable units on a trailer, and they would actually put a horse in it for about 3 hours.
Oh wow.
They
Of
weren't going 3 atmospheres, but
course.
they would put them in and they would just rotate through. The problem was they had a couple of accidents where like the shoes weren't taken off, and so they get a
Wow.
spark from the shoe. So they had some dramatic things that way that kind of lost people's. I mean, Major knows about. We were talking about them, but I think definitely they were being used for performance enhancement though at the Olympics. We're not treating injuries. We were basically treating performance enhancement, which
Yeah.
it was shown to be definitely beneficial. So, which is kind of cool.
Right. Yeah. So thank God it hasn't been banned for athletes, for
Right,
human athletes,
right.
because I mean, every now and again I will get a either Olympic athlete or a pro athlete that comes to the clinic, and I can't stress the importance of hyperbaric oxygen therapy, especially for their recovery.
That's
Yeah.
tremendous.
They're pushing their bodies so hard. I know they've got like the traditional modalities for recovery, but hyperbaric oxygen therapy can profoundly relieve that inflammation inside the tendons that can, if you let it go too long, it can create tendinopathies, right? So, or tendinosis. And hyperbaric oxygen therapy, I think, should be a part of every elite athlete's recovery protocol if they can tolerate it. Um, yeah. But like you, I feel great when I'm done with hyperbaric oxygen therapy. Like I'll be there Friday afternoon. I can't wait. Like,
We have a date Friday night. Maybe I
oh
should
yeah.
Oh,
cancel it.
Well, it's okay. Well, I got early hyperbaric. I think I'm there pretty early in the afternoon, so I'll have time to come home and relax, and then
Okay.
Get a
yeah,
cup of
I'm just,
coffee.
I'm just
exactly,
kidding.
exactly. Oh
it's
yeah, and another perk at Bennessair is they have fantastic coffee. It's some of my favorite coffee.
We
So
do, I know we just love going to Bennessair. I mean, I don't do the hyperbaric just because I'm a little bit claustrophobic. I do want to try it at one point, but I like doing the photobiomodulation and it's just a great it's a great clinic to go and hang out at the wellness bar and talk to
fun.
the team. And yeah, we see a lot of people that are coming into the clinic. And so you just feel like, it's an extension of the family.
Yeah.
So.
Major, thank you so much for taking time
No
to
problem.
our community. Again, I appreciate you for taking such good care of not only me, but also all the clients we send your way. Everyone raves about you guys, man. Like no joke. They're like, oh, we love the hyperbaric techs at Bennessair. They're just the greatest people. I'm like, they really are. You guys really are just amazing. And that whole experience matters because everyone I send I refer out as who are referred to as an extension of me. And so I'm grateful that you guys take such good care of our people because you make it really easy to send people your way. Like today, I think I passed out another 3 or 4 brochures. I'm like, you're gonna love the team there. If you got a moment, stop by before you go all the way home and just pop in. They'll take good care of you. If they have time, they'll give you a tour. If not, you can schedule your medical clearance and get a tour later, but you'll love everyone there. And they do. Everyone comes back and they're just like, man, we love it there. So,
Oh, you've sent us a lot of great people, and we enjoy working with you and seeing all your patients have a great success.
yeah, right on. Thank you.
Wonderful. All right, guys. Well, you guys have a wonderful night. And Major, yes, again, thank you so much for staying later at work and coming on to educate our community. We really appreciate you.
Oh, my pleasure.
Yeah. Okay. Everybody have a good Tuesday night.
You as
Good
well.
job,
Right on.
Major.
Take care, guys. Have a good night.
All right.